So one of the common complaints that people have is how to smooth out their skin, whether it's from acne scars or lines or textures. And the treatment that we found to be the best is this ablative fractionated treatment. There's many devices out there. We use one called the Core, but you can do it with other treatments. And what the treatment does is basically it produces a little hole in your skin, and it's kind of like when you're aerating your lawn. You have multiple little holes in the skin that set up a little wound, and then your body heals that wound up and smooths out the skin. It produces new collagen, elastic tissue to get that texture improvement. Our goal with our treatments is to get about 30 to 50% improvement, and that can take anywhere from, on average, 1 to 3 treatments. Rarely people get really good results with one treatment, and rarely some people just don't respond to it, but most people get within that range. The treatment itself, there is some downtime with it. It is uncomfortable, so we do give you some pain meds with it. And the treatment itself to treat the full face is about 20 minutes. And then afterwards it feels like a sunburn for a couple of days. The risk of adverse events or scarring is less than 3%. If it happens, it's usually from an infection. So we give you some antibiotics, antiviral medication, have you do some vinegar soaks for the couple of days afterwards. But most people are back to makeup in about 5 to 7 days. Usually afterwards, you'll have a little bit of pinpoint bleeding for a day or two, some swelling for about a week, and then the redness fades out over several weeks. It looks great initially because you're swollen and all the marks and scars are gone. As the swelling goes down, you'll say, hey, this really didn't do anything. So it takes the next couple months for your body to remodel that and create the new collagen elastic tissue to see the texture improvement. So that's why we wait about 2.5 to 3 months in between the treatments.
After the treatment, when can I resume my normal activities, kind of get back to my normal schedule?
So usually within a week you can get back to work, and even before that you can start, you can work at home and do some of your normal activities. We try to, again, want you to avoid the sun exposure, so be really good for the sun for the next several weeks. And then also heavy exercise and that kind of stuff, maybe the following week after the treatment would be okay. But you'll still have some redness that flushes a little bit for several weeks after the treatment as the healing process is continuing.